Good afternoon. This is Dawn Rustrom with the State Union on Aging. Before we get started, I'd like to do a quick sound check to make sure that everyone can hear me. If you can hear, if you could just comment in the chat box or in the question box to let me know. Okay, it looks like the audio is working. Fantastic. Thanks so much for responding to that for me. So welcome to the State Union on Aging's monthly webinar series. The topic this month is partnering to empower consumer independence by connecting consumers with assistive technology. This webinar is being recorded and can be viewed afterward. Please feel free to submit questions throughout the presentation. All participants are on mute for the presentation, but using the functionality, the questions functionality through the GoToWebinar, feel free to submit questions at any point throughout the presentation, and we'll be pausing at different points to respond to the questions. With us today, available on the line to help field some of these questions, we have Janice Castle, Darwin Frankenhoff, Christine Maciel, and Sandy Abrams. With that, I'd like to go ahead and introduce Lori Brooks with Access Technologies, Inc., who will be hosting this webinar today.
Thank you, Dawn. Yes, this is Lori Brooks. I am the president of Access Technologies, and I think, well, I created today's training, so I just think it's really exciting. It is about partnering, partnering in order to increase independence of Oregonians with disabilities. And I believe that's a goal that is near and dear to all of us. Dawn just explained to you about the wealth of information on our panel today. So yeah, send the questions in. And I will try to do a good job of remembering to ask if there are questions. So how did we get to this point? In 2016, the Administration for Community Living released a No Wrong Door long-term support and services grant opportunity for ADRCs to increase their collaboration with the state AT programs. In many, if not all of the states, at least from the AT program perspective, we were doing some form of collaboration, whether it was formal or non-formal with our ADRCs. But this grant helped to solidify the partnership. And that particular grant is designed to improve the provision and utilization of assistive technology for individuals with disabilities across their lifespan, as well as for their family members. And that's really important because we know that we need to be able to support not only the individuals, but the family members are asking the questions. Because of the services that we provide, I can't imagine it'd be surprising to know that life expectancy is almost 80 years in America now, and that most of us, as we age, we're going to require some type of assistance, whether that's with our everyday personal care activities, eating, bathing, dressing, or with our independent living activities, preparing meals, doing our housework, doing our laundry, etc. We also know that from experience, that if we provide the right assistive technology devices and services, as well as the correct specialized medical equipment, more of our seniors, individuals with intellectual or developmental disabilities, physical disabilities, mental illness, etc., will be able to live in their own home or community rather than in institutions or isolated settings. You might also know that unlike 5 years ago, many of today's seniors do not shy away from technology. Many have smartphones. They embrace wearable technology like the Fitbit and smartwatches. Many use smart technology in their homes as well as in their cars, in their clothing. That includes shoelaces and smart soles that have GPS tracking systems in them. And many of our seniors have sensors placed in their homes that allow family members to check in on them to make certain that they take their medication on time, they haven't left the stove on, they don't have a sink overflowing. I expect you have heard about cars that brake automatically when they sense that you're too close to an object that's in front of you. or that assist with parallel parking. But I recently heard a lady say that she had a new car that prevents her from changing lanes unless she has the turn signal activated. So when I step back and I think about that, I'm not sure if that's a smart safety technology or a hazard. There's a lot of situations when you make that really quick turn, and if you don't have your signal on, your car's not going to go. I'm not sure. Anyway, it's no surprise to me that the market for senior technology is rising. And that can be both costly and dangerous to our seniors, because whether it's the individual themselves or a well-intended family member that learns about a new gadget that's assured to increase someone's independence, if it's not the right fit for the individual's specific needs and their environment, then it's a waste of money, and it can ultimately cause harm to the individual. As part of the AT program, our staff eat, sleep, and breathe technology. So we hear stories of people buying the wrong accommodations regularly. For example, in the right situation, a grab bar with suction cups might be a good accommodation. After all, most now include a color indicator to let the individual know if the grab bar is attached correctly. However, further research of the product will show that those devices are intended for stability only. They are not intended to support the full body weight. So if your loved one is using that type of a grab bar and they were just a little unsteady in the shower, it might be fine. But if they accidentally slipped and or lost their balance and applied too much weight on the bar, they may wind up with a broken hip or worse. And the same hazards apply to traditional grab bars when they're not installed correctly. On this slide, you would see the images of grab bars as well as assistive listening devices. So when you're thinking about the traditional assistive listening devices, there are some devices that are not designed for individuals who wear a pacemaker. So those are just some of the other questions that are important when you're selecting devices for your loved ones. As the assistive technology program, our activities are mandated by Congress, and those activities are designed to increase access and acquisition to assistive devices and services. We're going to talk briefly about what those look like, and then we'll take a deeper dive into that a little bit later. So as the AT program, we are all about interagency coordination and collaboration, public awareness activities, and we provide training and technical assistance to professionals a lot. We do individuals when it's in a group environment, but the training and technical assistance is not designed to be like training an individual on how to use a specific device. The AT programs also support a range of state financing activities. It's important to help consumers be able to acquire the devices that are right for them. And then we manage a device loan library and also provide device demonstrations. I think we lost a slide in here. So we're just going to kind of back it up a minute. So with this partnership, it was, again, decided or designed to allow the AT programs and the ADRCs to really work closer together. And when I first met with the ADRCs to talk about what that partnership might look like, we talked about the collaboration activities that we could do together. We talked about having ATI reviewing the ADRC database and providing recommendations for any services that might be missing. Talked about how to work with you all to increase your knowledge and awareness about assistive technology, so that if you are referring people and or just talking to individuals about assistive technology, you'd be more comfortable with that, making sure that you had the right information to provide to individuals. We talked about how to work with specific outreach activities. Is there a way that when we're out doing conference exhibit tables, can we, be sharing ADRC information at the same time? And could you guys be sharing information about our programs at the same time? We also talked about the possibility of developing assistive technology demonstration kits that would be available in some of the ADRC centers that the staff would use for outreach and educational events, not for device loan. We talked about the way to support those kits would be to provide specific training and technical assistance to staff with those kits, as well as information on how to maintain those kits. And we talked about ways to develop and strengthen our cross referrals between the agencies, and the importance to have ATI participate on the ADRC's advisory council. I think it's really exciting that out of the whole list of measurable objectives that we looked at, the only activities that were not included in the proposal were those focused around the AT demonstration kits. So that's how we got to where we are today. So now we're going to just take a step and look at who Access Technologies, Inc. is, and then talk about the services we provide and how we can work closer together. So before we go into that part, are there questions yet that we should be looking at?
No questions that have come in yet. Just a point of clarification. I'm not sure if it'll be mentioned later on, but rather than doing the traditional demonstration kits, we are doing sort of a different version of that, where we're creating assistive technology toolkit that can be offered to staff to take in the field to show to consumers that would have pictures, images of different assistive technology devices, and would have some limited information available about those devices, and hopefully also a video demonstration for each of the devices as well at some point going forward. So I just wanted to make sure that you all were aware of that as well.
Great, yes, thank you. Okay, so Access Technologies, Inc. is a 501c3 nonprofit, and we conduct a number of fee-for-service activities under our nonprofit umbrella, but we're also very pleased to manage 2 federal grants. Our vision and mission statements guide the services that we provide. I'm sorry, I have a pop-up that came up. Oh, I think I'm too close to my microphone, sorry. And so all of our services have to follow our vision and our mission. So our vision statement is noted on this slide that we are a society where all people are valued and respected, and where all people have the knowledge, opportunity, and power to improve their lives and the lives of others. And our services also have to follow our mission, which is to ensure that persons with disabilities in Oregon are able to secure and effectively use assistive technologies. So I think you hear that, throughout everything that we do. That really is what drives us. Under our nonprofit umbrella, we provide a range of assessments. They're not just conducted in your typical home, office, and education settings. Our assessments are performed in orchards and wineries and machine shops. They're conducted with law enforcement officers, as well as individuals who work as outdoor advertisers. These include ADA and workplace, as well as ergonomic risk assessments to help individuals and their team identify the correct assistive technology devices to allow them to be independent at home, at work, at school, during their play, as well as in their community. And assessments that allow individuals to access and use their computer and smart technologies. We also know that having the right technology or workplace accommodation is only the start of gaining one's independence. And the real barrier can be learning to use the devices to its fullest potential. So we provide individualized training on all types of assistive technologies, softwares, and apps, computers, tablets, as well as ergonomic and workplace accommodations. ATI believes that every American should have the ability to use our nation's communication services. And we believe that the ability to communicate enables people to be independent, productive, safe, and secure. So we were excited when we received the opportunity to manage the ICAN Connect Oregon National Deafblind Equipment Distribution Program grant. As you can tell from that slide, this program allows us to work with individuals who have combined hearing and vision loss. And it provides assessments to help the individual identify the right technologies that will help them with their telecommunication needs. So anything that is not face-to-face. It could be email, it can be surfing the internet, it could be doing Skype, it could be using a cell phone. The program buys the equipment for them, and then it provides training so that they are able to independently use that technology. So we work with individuals throughout the state of Oregon, and we work with individuals of all ages. We have provided services to individuals as young as 7 and as old as 93, and in all parts of the state. When we were first putting the program together, our stakeholders thought that, primarily the individuals would be, residing up and down the I-5 corridor. And our very first people were at the very far corners of the Oregon coast, one way at the very southern tip and one very north. So it was really not what was expected, but very surprising. And this program allows us to meet a lot of really, really wonderful people. So we also manage the Oregon Assistive Technology Program. And this is where we're going to spend most of our time today talking. So under the AT program, we conduct device demonstrations. And it's important to understand what a true demonstration is. There's a difference between scheduling a demonstration with our specialists and having a guided hands-on demonstration than going to, say, your local, Best Buy and looking on your own at devices. So we think it's important for people to be able to compare features and functions of devices and talk to people that might have good knowledge about that. And we believe that's important whether you're looking for a bath bench for use following a surgery or if you're looking for alternative communication devices. It's just helping to make sure that the individual has the right equipment to match not only their needs but their environment. So last year we provided personalized device demonstrations to over 4,200 Oregonians. The program is also designed to provide device loans. We have over 2,000 devices in our lending library. Some of the devices are only available for demonstration, and then some are available just for use maybe in our Salem office because they're too big to transport around, so people come in here to see a demonstration. We're going to look at our website a little bit so that you can get an idea of the loan library. But one of the questions that we are asked is, how is equipment selected for the library? That equipment is brought in based on requests from our consumers and professionals that we work with. Sometimes the equipment's purchased through grants and other AT programs, in which case the technologies have to follow that grantor's request. So if we were working with, say, an employment agency and received some funds for equipment that would be good for employment purposes, then we need to earmark that technology to be loaned out to individuals that meet that qualification. Some equipment, like I was saying, is only for demonstration purposes. And that can also be because we need to follow FDA guidelines. So technologies that could be used with food or placed in the mouth, like eating utensils, are for demonstration purposes only. We know that it's possible for individuals who want to compare different types of eating utensils to practice scooping with them without actually putting the utensil in their mouth. And so it's very feasible. I want to make sure I don't jump over to our website too fast. I was asked to make sure also that we share consumer stories throughout part of the presentation today. So we're going to talk about one of our individuals that came in for a demonstration, and I'll give you an idea of how that process works. We always change the name, so don't even try to figure out who the consumer is. But the device demonstrations are really designed to empower individuals. We want people to make sure that they can make informed decisions and not waste money. We hear stories of people who have bought the wrong devices, and it might be, a senior, and they're kind of embarrassed for having found this thing online someplace or through TV, and they bought it and it doesn't work. So they just hide it away in their closet, and then their adult children find these things and they're like, well, what in the world were they doing? Well, they were just trying to be a little more independent. So if they can just learn about the technology through free demonstrations, and it helps them to prevent making wrong purchases, that's what we're about. So last year, we had a mom contact us, and we'll call her Pam, and she lives in a rural part of Oregon. And she scheduled a demonstration to learn about assistive technology devices that could help her son overcome literacy barriers. Pam had explained that her son has struggled with reading since he was in the 2nd grade, and he was now in the middle school, but he really worried about standing out. We know there's lots of different technologies that could help individuals with literacy difficulties, but some are just more apparent than others. So Pam and her son explored assistive technologies, different devices, different apps, different software programs that are specifically designed to accommodate individuals with different learning styles. And they did it in our Salem office with one of the specialists. And by the end of the demonstration, the son himself had identified several different types of technologies that he thought he would be comfortable using in a school setting around his friends. And the mom really had a much deeper understanding of the technologies, and she was then going to take that information back into her son's IEP meeting. She just gained the confidence that she could do that, and then she followed up with us, and she was just really excited. His IEP meeting went so much smoother because she just knew the technologies that were out there, and she didn't have to just rely on what the school was telling her was going to be right for him. And then, he wasn't feeling so out of place at the school when he got his new stuff. He was able to help select the technologies that were right for him. So whether it's, kids in middle school or our seniors, it's just super important that they get the equipment that's really, really going to work for them. So I think I told you we have over 2,000 devices in our library. And again, the devices selected in the library are done much the same way as the equipment that's put in for demonstration purposes. So let's go see if we can click into our library. Okay. So when you pop into our home page, this is what our website's going to look like for you. And you're going to come up here on the top, and you're going to click into device loan. And I have this lovely screen over here, so I can't see everything. I don't know if I can I minimize that or just move it? Oh, I'll just put it down here. Okay. So when you pop into the device loan library, it's going to give you just a page of unsorted devices. And you can see over here that you can filter devices by age category. So if you're just looking for seniors, you would click here. And if I have tagged everything correctly, you will have equipment under seniors. Most people will sort by device type. So let's say we were looking for hearing technology. We'll click here. And we come over here by this other sort feature. And I like to sort by the item name. And so you will see we've got alarm clocks that come up first. Because we have a lot of equipment and I'm still adding devices to the web page for you to find it, that's in the library, we're trying to put, a little heading in front of everything so that when it sorts, they all stay together. So if you're looking at different types of alarm clocks, all the alarm clocks are going to come up together, right? Okay. So for everything that we have a photo of, you would see a picture of it. You can click either on the name or the picture. And you'll go in. This is the identifying number for the product in our library. And then we should have a model information if it was available. Your rental terms for most of the equipment, it's just a straight $9 maintenance fee for 30 days. We do contract. Individuals fill out a contract indicating that they'll be responsible for the equipment. And we do ask them to leave a credit card on file. That way, if they decide that they want to extend the time of using the equipment, they can just give us a phone call. After the initial 30 days, then it's $20 a month for whatever they're wanting to actually rent after that. We provide information on where you might be able to purchase that device or who the manufacturer is, depending on what information that we can find available for it. And then information about the equipment itself.
So Lori, this is Dawn. We do have a question.
Okay.
The question is, can demonstrations be scheduled at a client's home instead of in the office, especially for clients in rural settings with limited access to transportation? I could see this being particularly helpful because they are the most inclined to order equipment since there aren't DME supply stores in rural communities.
Right. So thank you. Yes, I probably skipped over that part. We do demonstrations both in our office here in Salem and on the road. Our specialists spend a lot of time driving throughout the state. And what we try to do, because demonstrations are at no cost, we try to group them when we're doing another service in that area, or when we can partner up with an agency like yourselves and do what we consider a device demonstration day. We call them AT demo days. And then the agency just invites a range of consumers in. They'll put out a press release. We've done that in Ontario. We worked with the Independent Living Center in Ontario, and we had a hearing and ergonomics, I think is what they wanted at that time. And so they just sent out a press release and had people come in for that day. And so, yes, they do demonstrations in their homes. We do demonstrations at their work site. We do it at the schools, wherever it makes sense for the individual. Yes, we do demonstrations out in the field. Unless it's the heavy stuff, the stuff that doesn't transport well. And I'm trying to think of something, sometimes people want to look at the height adjustable workstations. We'll just pick on something that's not traditional, that's in here because we're not going to be able to haul it around. Okay, does that give you an idea enough on our loan library there? Let's click this.
Another question.
Okay.
So, if a client without a credit card would like to use the lending library, do you accept third-party credit cards for holding the rental, such as credit card from an agency or nonprofit?
No, individuals traditionally will use their credit card, or a family member would use their credit card to secure the equipment. Occasionally, an agency will rent equipment, but it's primarily the individuals that are renting the equipment. Let me give you a scenario. So we do a lot of work with vocational rehabilitation on our fee-for-service activity. And if we've done an assessment and we've identified technology that could work for them, but the individual wants to borrow the equipment for an extended period of time while they're waiting for the equipment to be purchased for them, VR might agree to rent that equipment for them. However, who's going to sign the contract? Who's ultimately going to be responsible for that equipment if something should happen to it? Maybe it's a laptop computer. The individual needs to complete the contract. And so we work really close with VR. They might secure it with an authorization. But if the consumer harms the equipment, the consumer has signed the contract that ultimately they're responsible for it. But I would say 90% of the equipment that we loan out is directly to consumers. Mm-hmm. So we know that, you know, education's important. We know that work is important, but we also know that playtime is important. So we have equipment in our lending library for recreation. And I'm trying to find something I wanted to show you. Okay. So you saw up here we have toys for young children because it's important to use toys to help children learn cause and effect, to learn how to play together. We have this race car set. We put different types of switches on the penguin roller coaster, take it to exhibits, and let kids race their penguins around on the little roller coaster using a switch. And we work with individuals with hunting and fishing and all types of recreation. So you will see down in here that we have a high quad pistol mount system for someone to use. It sits up on an individual's wheelchair. This particular picture is of a high quad individual using it, and so you would see right here that the trigger activation is done by a switch that's in his mouth. And although this picture is not really easy to see, it is a compound bow mount system. There's a platform right here. It fits underneath the seat of the wheelchair cushion. And the way it is set up, it's designed for somebody that has upper body strength. And this particular compound bow mount system was checked out to an archery 4-H club. The 4-H leader had found this system on our website, and he made all the arrangements with us. He is in a very rural part of the state, and he met up with the specialists as they were traveling around that area, and they did the contract signing and everything alongside the freeway, basically, is what they did. In order to take the mount system into the 4-H club, the leader had to secure additional insurance, and he had to have permission from the extension service. A lot of hoops to jump through, but he did all of that, and then he borrowed it from us so that his 4-H youth could participate in practice with archery with his, fellow 4-Hers. And they found out that it was working so well for him that he was able to compete with it. And then his family purchased him a mount system for himself to continue to use. So, they're just exciting stories that we know about the individuals who have the chance to borrow the technology to see if it's going to work. The mount system, when we bought it, it was about $475, and that's a lot of money for someone to put out because maybe it's going to work for their kids and maybe it's not. It's the same thing for our adults, you know. We just have to be sure it's going to work. Sometimes when an individual is going to access the lending library, they need to have a little bit of training on the equipment. So they will need to meet with a specialist or have it shipped to them and then do training remotely with that device to make sure that they're going to be able to use it appropriately. So if the equipment is going to be shipped somewhere, then the individual is also responsible for the shipping and any insurance that they need to put on that device. A lot of times individuals will, again, just meet up with us when we're in their area and borrow the equipment. Let's see if we can
Another
back here.
quick question. How does remote training work?
So we do remote training in a number of ways. If we're doing it because a person is trying to learn the device that they're borrowing from our lending library, then we need to have two devices. They need to have one in their, physically with them, and then we have one here. And we can do it over the phone, or if it's, using a video system and doing a computer training that way with them. We can do it that way too. So it just depends on what works best for the individual, what they're comfortable with. If we need to Skype them, we use Skype. If we are doing something where they really need to see what we're running on our computer, we'll use Team Viewer with them, or, whatever works better for that individual. Does that work for your question?
As far as I know.
No follow-up to it. Okay.
Thank you.
Let's see if it'll move on now. Here we go. Great. Okay. Congress also requires the AT programs to manage state financing activities. And what is really fascinating with the AT program is every AT program can design the activities in a manner that makes sense in their state. Okay, so for Oregon, our finance activities include an assistive technology purchasing plan. So we partnered with Northwest Access Fund, and they provide low interest loans to Oregonians with disabilities to allow them to be able to purchase modified vehicles, the vehicle modification, home remodel, assistive technologies. Depending on the funding stream that Northwest Access Fund has, that dictates the type of AT funding that they can do. So just like our loan library and demonstration library has to be dictated by where our funding comes from, theirs does too. So this is the early part of our partnership. We're just starting the third year. And so Northwest Access Fund has been really busy doing outreach to Oregon. They initially were set up in just the state of Washington. And so last year they made 12 loans to Oregonians. There were some vehicle mods, a number of hearing aids. Those are their primary loans. Just last month, the director and two of the outreach folks from Northwest Access Fund spent a number of days in Oregon. So they came down here to tour our center and see what the difference was between the Oregon AT program being ran under a nonprofit compared to the Washington AT program that's ran through a university. And then they were out doing a lot of outreach with audiologists around the state. We also manage a cooperative buy program. So when you come into our storefront, that's what you see first is our cooperative buy piece. It's also called the Assistive Technology Marketplace. So we work with a number of durable medical equipment providers to bring in equipment at a low cost, because primarily individuals purchasing equipment through the marketplace are doing so because they do not have insurance that's going to cover that equipment, or the process for buying the equipment is really, really long, and they just need to acquire that technology. So common equipment in the marketplace would be, I can't see out there, it makes it a little harder, bath chairs, transfer benches, manual wheelchairs, 3-in-1 commodes, that kind of stuff, hip kits. So people that are having hip replacement surgery. Salem Hospital refers a lot of individuals over here for the equipment that they will need following surgery for their recovery. We have portable ramps in the marketplace now, because we found that even though they're in our loan library, people are needing them for a lot longer. Some for permanently, and so we put some portable ramps in the marketplace. What else? Odds and ends of smaller items. We can do a tour. I think I've got that link in here too, to do a tour of the marketplace too, if we have time to do that. Let's see. Also under the state financing is the device reutilization program, which is used equipment. So because Access Technologies is a nonprofit, we can receive in donations of clean, gently used equipment. We clean it, we sanitize it, we do minor, and we stress minor, repairs to get the equipment back up and ready for its next home. And then we don't actually sell the equipment, we just charge a service fee, if you will, for what it costs to get that equipment ready for its next home. So it's very common to find a power wheelchair that has been donated in, cleaned, and put back up for sale to somebody, if you will, for $75. Because we traditionally will not go out and buy new batteries for a power chair. Sorry about that phone. If the power chair needs batteries, then we will have test batteries for it for the consumer to try it with, and then we will give them the information on the batteries that they would need. What we found was if we buy the batteries, say you bought the batteries today, the warranty for that battery starts now, and if the chair doesn't move quickly, then the person's losing out on their warranty for their batteries. In addition, that's just more work that we'd have to do on keeping the batteries charged, and it was just not cost effective for the program to do it that way. People would look at the price of the chair with a pair of, new batteries that are probably $400 or $500 and really balk at the price of the chair, because what they were doing was actually buying the batteries, but the battery warranty was, dwindling the longer the chair was here. So we found that when we have power chairs come in, particularly, that if we just sell them at the cost of getting it ready to go on the floor, which is about $75, that the chairs are, unless they're a really unique chair, they're just kind of in and out really fast. We did have a volunteer for years and years and years that would come in once a week and go through the power equipment specifically with us, helping us make sure that it was up and ready to go. But we all get older and have to back away from some of those volunteer activities, and he did. So now we're without our volunteer and really are looking for another person who is good in that area. So if you know anybody, please point them our way. As equipment ages out of our library, it becomes not available for purchase for new, but it still has a good benefit to a lot of people, we will place that up in the marketplace and sell that, and then use those monies to purchase new equipment into the library. So I think we can try to take a quick peek at our marketplace online.
Lori, I have 2 questions.
Awesome.
All right, so if a client purchases an item through the cooperative marketplace, how do repairs work? My understanding is that insurance typically only repairs equipment that is purchased through the insurance directly.
Right, so let's look at the type of equipment that's in the marketplace, and that might help to answer your question. You might be, and I'm not sure, if you have a specific example of equipment that you're looking at. Maybe you're thinking of a power chair that might be new. Insurances would tend to work on a repair for new power equipment, where they might frown against, and I can't say 100%, but I hear they tend to frown against repairs on previously owned electrical equipment. So in that case, that is, the consumer's responsibility. If it is, and we'll look at it, so say it's, let me put these in a little quick, manual wheelchair sort. Hello. If it's a manual wheelchair that they purchased through us, or a bath bench or something like that that's new, the warranties are with the manufacturers, but because we buy directly from a manufacturer, an individual can't go to the manufacturer for repair, so they work through us for any appropriate repairs. And when you think about what's in equipment in the marketplace, when individuals submit to their insurance company for reimbursement, so you can see like the manual wheelchair here is going to be $185. Because we do not bill insurance companies, and because we're a nonprofit managing the Oregon AT program, the providers that we work with to acquire this equipment in the marketplace really work with us to get as low a price as possible for the consumers. So a lot of times, if an individual has a choice between 2 items that their insurance will purchase, could be a manual wheelchair and a walker, we'll say, they'll look at which one might they need more support through their insurance company for in the long term. And that's the one that they will go and have their insurance purchase. And then they will privately pay for the other item. And so that helps with that question that you had there too. Did you have a second question or a follow-up for that one?
I did have a second question. I think you answered it. It was, a lot of our Medicaid consumers can't afford devices. Do you bill Medicaid for any of these items?
Yeah. Right. Yeah. So I did kind of answer that, huh? Yeah. We have not set up that process. We go back and forth. And if we did, then we would look like most of your other durable medical providers, and the cost of the equipment would be a lot more expensive. Some of the state AT programs have worked through that process, and they are billing insurance companies. Again, it's just an avenue that Oregon has chosen not to do yet. When you're looking at the marketplace, it's going to look very similar as the loan library, but you're going to have your prices right here. Let's just open this one up. So it would have a contact name of an individual. So this is an individual who has an ad on our marketplace to sell their item. Okay, so that is through our exchange program. And it's just basically like a want ad. They can post equipment that they want to sell on our website. It doesn't cost them anything. And I think you'll see that most people have submitted a picture of their item. We traditionally leave the ad up for 90 days. We do ask people to please let me know when the item has sold or you've donated it so we can take it down. Otherwise, if it just looks like it's been there for, 6 months or 9 months, I try to take it back down. If it's equipment that is new that's in the marketplace and it's something that we have, when you look at it, it would say the contact name is ATI. And in the description someplace it will say new in the last part of it. And then if it is something that is here as a used item, again, it would show ATI as the contact, but it would show used in its description. When you're here, that equipment is pretty visible that it's used because we put yellow tags on that equipment so individuals know that when they walk in that, oh, hey, that's a good bargain because that was, previously owned. Now I have to remember how to get back to this little dude. Oh, there he is. Okay, so under the AT program, we do a number of public awareness activities. Our staff do approximately 40 exhibit tables and/or presentations a year. We also have a newsletter that we send out quarterly, at least quarterly. Sometimes I have enough articles to write because I serve as the editor for it. When I can get the articles written, I do it every other month. And that newsletter serves more as a wrap around our marketplace. So we're sending out examples of what is in the cooperative buy marketplace, as well as what consumers have listed on the website to sell. We traditionally send that out. I think my print mailing list is up around 3,000. And then we have an electronic list of people who have, requested to receive it electronically. And then I also post it up on our website so people can get it whichever mode makes more sense to them. Information and assistance is another huge activity that we provide. Those are our 800 number calls, our local calls, people that walk in here for information, people that are just asking for information and referral type stuff, the general information at conferences. So last quarter, we provided over 8,600 INA services to consumers and professionals. Well, I thought my slide went in advance. Let's see. Here we go. So Dawn wanted to make sure that I talked about what are appropriate referrals, what is our referral process, and what's the consumer's experience when they contact ATI. And I'm like, gosh, I really don't know how to answer that question. I think anything that pertains to assistive technology services and devices, I think that's an appropriate referral. And I don't know that there are any referrals that are not appropriate because, like you guys, we're tasked with helping individuals find the right source. Yesterday someone came in looking for toilet seat covers, and I'm like, I wonder why they came here for that. But it doesn't matter what they're asking for. If it's something that we don't have, we're going to pop online. We're going to help them find it wherever it is. So I guess don't send everybody to us. That we wouldn't want that. But if you ever wonder, geez, would it be appropriate to have people call you for that? Just ask if you have a lot of the same type of questions, or maybe we can provide you with some additional information and you'll be able to better answer that question instead of having to refer them. I think it's learning how the two agencies can work better together in that process that's going to really help our consumers in the long run. So what is the referral process? Well, if it's a call or an email, whoever gets that call or email in here is going to answer it for you. We might ask each other, hey, do you know where, such and such is the best, I don't know, vendor for this, whatever it is they're asking for. Sometimes our questions are, where can I donate this? Because it's an item that we cannot accept in. CPAP machines is a huge one. We had a good source for CPAP machines, and we don't have that source anymore. So sometimes that's what our referral information is about. So we just handle it. And what do they experience when they contact us? They better have 100% quality customer service is what they better experience. I have new staff, and they're great. If they don't have that heart to give that customer service when that person comes in, regardless if they're asking for toilet seat covers or they're, asking about information on a product that we can help them with, they're going to get that same level of customer service that they need. They need to leave us or hang up the phone or be satisfied with their email that they know where to go to acquire the technology that's going to help them to be more independent and successful with their life. And I think that's probably a good place to see if we have more questions, especially about the referral piece of it.
As of now, there aren't any questions in the queue.
We're just doing a great job, Dawn.
I know. And so, I think you covered some of this earlier as well. So my question around, let's talk about the consumer experience was really around that device loan library process and
Okay.
how it would work. But I think you did a good job of covering that earlier as well. So.
Okay, we're going to move on to our reference sheet, but I think this is a good time to.
I have.
Let me just say, every time my door opens, our front door opens, an alert goes off in here, and so it's really distracting. I'm very sorry.
Okay, so here are a couple. So it says, we are having a very big problem with clients waiting many months for their DME to arrive after being requested through their insurance and a DME store. Can you help clients keep on track of these requests and help them get their equipment earlier? And this is keeping some clients homebound for many months while waiting for equipment.
So that's one of the activities that the loan library is designed for. Also, we have to answer 5 or 6 questions when somebody uses the library. Why are they using it? That's the question. Are they using it to make a decision as to whether or not assistive technology is right for them? Not is that device right, but is assistive technology right for them? And sometimes the answer is no. I'm quite fine. I borrowed that assistive listening device, and I found out that I hear just as well without an additional device as I do with my hearing aids, right? Or it's like, wow, yeah. I realized that this particular writing aid is just the cat's meow, and boy, I can just do a much better job. I can sign my checks now. But another question is, are we borrowing it for a long-term accommodation, or are we borrowing the device to serve in between while we're waiting to receive our device that's being funded for us? So it is possible that the lending library may have equipment that the person can borrow while they're waiting for that to come through their insurance company. We wouldn't be able to, and I hope I'm not misunderstanding that question, we wouldn't be able to reach out to the insurance company, and prod them along. And if you're working with a DME provider who's going to bill insurance companies, we probably can't prod them along either. They have so many rules and regulations that they have to follow when they bill insurance companies, which is, obviously one of the reasons that we choose not to do that. So is there a specific example that you want to see if we have that type of equipment in the library? Do you want to talk further about what other items you might wish us to consider to be in the library, or is that a little premature and you want to just poke around on our website and see what's there first? Feel free to, type any and all of those responses in that chat for Dawn.
I'll monitor that and let you know if something. She says, "Well, we'll take a look first. Thank you."
All right, great. And feel free to call me. Anytime you have any of those questions, we can talk about it. I have great gatekeepers. If you haven't phoned in our office and asked for me, I have good gatekeepers. Their question will be something like, is she expecting your call? Will she know what this is about? Just say, hey, we're with the ADRC. We'd like to do a follow-up from the training. And they'll get you right through to me. Otherwise, they're going to try to answer your questions for you. So, and that's okay also. I don't care. Okay.
And if you guys if you have a positive experience where you do work together to implement something like this, let us know so that we can share it with the rest of the network as well, in case other folks are having a similar problem, and we can send this information to help be able to better support consumers in their areas too.
Exactly. Okay. So we're going to talk about the activity that Dawn and I are working with. Oh, yes. So I threw this slide up here, and then I'm looking at it going, oh my gosh, it's kind of small. I hope you guys have a large monitor there. So we're working together to develop, Dawn talked about it a little bit early on, an outreach activity. So rather than providing equipment in an AT demonstration kit, part of that will be to develop posters, and Dawn will probably be able to speak better at this. So let me just butcher it up, and then she can clean it, make it all pretty for you. So we're looking at different technologies that could be on the poster, as well as providing information about those devices. So this is an example of a poster project that was created with the New Hampshire Assistive Technology and ADRC program. So you can see on their poster they had a rocking tea knife, a reacher, some silverware with larger grips, different types of jar openers. And then on the flip side of the poster, it has a description of the device, the name, the description, and then a QR code about that. So we've been busy taking pictures of devices. There were all kinds of photo shoot opportunities in here, I guess you will. And Dawn, you would be pleased to know that as of this afternoon, I finished my rough draft of writing up information on all the devices and tagging those numbers for the pictures onto the devices.
Yay.
I know. I did, like 2 steps in one, which was helpful because 2 of the items that we did with our photo shoot have been discontinued. So there was like no sense of putting those on the pictures or on the poster, and I figured that out as I went through looking up additional information on the devices. So a couple of items won't be on there. So Dawn, do you want to take a minute and kind of elaborate on this project?
Sure, I'd be happy to. Yeah, I'd be happy to. So a couple things. There are 2 products that we're developing. One is the poster that Lori speaks of, and this would be a poster to display in offices as an awareness part of the project to really promote the ADRC and the Access Technologies Inc. program. And the second product would be a toolkit for staff to be able to use in the field. And that's sort of what you saw the picture of on the last slide that Lori showed. And the idea is that you could have, and I'm not sure, exactly what it's going to look like in tangible form, but pages that have images of the assistive device with some brief information about it. So a description of it and a QR code that link you to the document that's being maintained online, and that would have a link to a video of that device. And those videos haven't been created yet, but the video would have a demonstration of that particular device so that you would be able to take these pages into the field with consumers, flip through the pages to show images of the device, have the brief information about the descriptions available to share with consumers. And if you have a smartphone or an iPad, you would be able to, by clicking on the QR code, go to the page that has the video link to be able to actually show the brief video demonstration to the consumer in the field, in their home, if they come into your office. And so those are the things that we're working on. The devices that included, at least for this round of the project, are devices that are available through the AT loan library program. So there are items that your consumers would be able to access then after and then go on to purchase. So they would be able to access them, to borrow them, to use them, to see if it's what they need, and then to make the purchase.
Great, thanks. So I'll back up one slide here. This is an example of some of the devices that we took pictures of. They're great pictures. There's multiples of everything. It's kind of the way the pages came to me, so I didn't pretty it up for you. So all kinds of different types of magnification devices, some mobility devices, some hearing devices, writing aids. We're trying to keep it, I guess, kind of general for the first go around, and see what additional information you'll need. And then the pages will probably look something like this. So like Don said, you'd have a little description of the devices, the name of it, your video link, an average cost of it, if it's like one item, if it's grouped together, or it's, you know, depending upon the I don't know, features and functions of the device, the price could vary. So in those cases, we couldn't really give them a price, but most of them, we can give them an approximate price, and how to purchase it. I think, everything that we will put initially in this project, an individual could always contact us for purchasing information. If it's something that we cannot save somebody money with, we're going to let them know that and point them off in another direction. We like to make sure that people always are aware of their options. So, you know, people will buy stuff online. Sometimes we can save them money and they'll just buy it from us. I can't give you lots of examples other than what's on this page right here. The Bip Grip pen holder, I doubt we would save anybody money. So if they were not comfortable purchasing online, they may have us purchase it and they just buy it directly from us because they don't like to put their credit card online, for example, you know, or they don't want to phone and give somebody else their credit card because they can't see that person face to face. So sometimes like that, people would just as soon just purchase it through us. So that's the ending of our slides. So if you have other questions, comments, do let us know.
And monitoring to see if anything's coming in. And those of you on the call, please know again, we have Janice Castle, Darwin Frankenhoff, Christine Maciel, and Sandy Abrams on the line as well. If you have any assistive technology related questions that are more APD related and less access technology related, you're welcome to throw those out there as well. Give it a minute in case, here comes one. You may have covered this, but do you provide delivery of the item?
For the new items, We will meet anybody anywhere, let me tell you that. So sometimes we'll have somebody purchasing something out of the marketplace and they want to just pay a small delivery fee to have it delivered, that it's outside of our traveling area. So the answer to that is yes, we do.
For the loan library as well that you...
Same way, yes, yeah. Mm-hmm.
Next question, how do you coordinate with the Commission for the Blind?
Say that again, how or do we?
Do you and how?
Do we and how? So yes, we do coordinate with the Oregon Commission for the Blind. And how do we coordinate with the Oregon Commission for the Blind? Well, first, I have a representative from the Oregon Commission for the Blind on my advisory council. And second, we do assessments for some of their individuals. And they also borrow equipment from time to time from the Lending Library. And we do trainings for their staff.
Right. Waiting to see if anyone else may be typing in a question.
I'd also encourage any of you, if you want to do a demo day in your area, it's a great way to learn about the equipment, whether it's just for your staff or you want to invite the public to come in and do a hands-on on if you want to keep it focused on particular equipment, you know, just hearing and vision, or you want to open it up so it's, I don't know, hearing, vision, and daily living or whatever. Let us know. We'd be happy to do it. We're trying to do a better job of using our Facebook to say where we're going to be for events, events particularly that are open to the public. We do a lot of specific agency requested events, you know, so they're not open for the public, so you wouldn't see those there. But we're trying to do something so that people would know that we're going to be in their area. One of the questions that I would be asked from even our advisory council is, well, I know you're up and down the I-5 corridor, but are you ever in Bandon? We're like, oh, we're not telling you that enough. Okay, so we try to put something on the Facebook that says, you know, the staff are in Timbuktu today. I don't know. And then the advisory council have to sit through a report that tells them every city we're always in. So they know they can't ask that question anymore. So we travel all the corners of Oregon.
All right, so I don't see any remaining questions. So please feel free, even after the webinar today, if anything comes up, feel free to submit questions as well. Thank you so much, Lori, for being with us today and for hosting this webinar. Rachel Jacobson says thank you. This is helpful. And thank you so much to APD staff for being on the line to field questions as well. We really appreciate it. And everyone have a wonderful sunny afternoon.
Great. Thank you so much.